Hospital-acquired infections, HAIs, which are also called nosocomial infections, are a big problem in healthcare. They're infections that develop in patients during their stay in a hospital or any other healthcare setting. They're infections that patients will contract while receiving a treatment for other conditions in a healthcare setting. These infections are not present in a patient at the time of their admission. There's many different types of hospital-acquired infections. Common types include urinary tract infections. These are usually associated with the use of catheters in patients, which can introduce bacteria into their urinary tract. Bacteria like E. coli and others can stick to a catheter, and then they can go up a bladder and cause an infection. These bacteria can form biofilms, which are communities of bacteria. They can stick to surfaces, and they're pretty resistant to antibiotics. Next is surgical site infections. These are infections that occur at the site of surgery. So bacteria like Staphylococcus aureus, which can include MRSA, can enter the surgical site during the procedure, and they will stick to tissues and can produce toxins that damage cells and cause a lot of inflammation. So surgical site infections are also common types of hospital-acquired infections. Another common type is pneumonia. This is especially common in patients who are put on ventilators or oxygen machines. So pathogens like Pseudomonas aeruginosa and others can enter a tube, and they can enter the lower respiratory tract like your lungs, and they can produce various virulence factors that make it hard to fight and cause a lung infection. Another common type of hospital-acquired infection is a bloodstream infection. These are usually associated with the use of central venous catheters, and bacteria like Staphylococcus epidermis, like the bacteria on our skin, can get in and cause a bloodstream infection, which is a very serious infection, which can cause systemic infections like sepsis. Finally, a common type of hospital-acquired infection is colitis, which is caused by Clostridioides difficile. This bacteria is normally found in us in tiny amounts. But when someone is taking antibiotics, this can disrupt their normal flora, and this bacteria can flourish and cause a lot of inflammation, which causes colitis and really bad diarrhea. So the factors that make hospital-acquired infections very common are the microbe, the host, which is the patient, and the setting. So we have a lot of microbes in a hospital. It's a community of antibiotic-resistant pathogens and other pathogens. So there's a lot of microbes. You have a patient who's immunocompromised, meaning they have a weakened immune system because they're already going in there to get some sort of procedure done. You're touching the patient, you have catheters going in, oxygen machines, and then finally the environment. So sometimes you have lack of proper sterilization of medical equipment, and basically a hospital is an incubator of pathogens. So pathogens can be introduced into the patient's body through contaminated medical instruments, through the hands of healthcare workers, through the air, through different machines. Many bacteria can form biofilms, which are communities on medical devices like catheters and ventilators. Biofilms are resistant to antibiotics and immune responses, and this allows a lot of persistent infections. We also have antibiotic resistance, so there's widespread use of antibiotics in a hospital, which can lead to the development of resistant strains, which makes it harder to treat. And then again, you have a compromised host who can have an illness, surgery, or be on treatments like chemotherapy that lower your immunity. And then the environment where you have pathogens on surfaces, the air, everywhere.